we'll turn the time over to Karishma.
All right, thank you. And thank you for inviting me here to speak about my project today. I'm really excited to be here. My project that I'm going to talk to you about is the project that we started. It's partnering with community health workers to engage in community-based participatory research. This is not a project I did by myself. I had other students helping me, Jazmine, Sonia, and Siale. I don't see any of them here, but a huge thanks to them and all the work they put into this project. I want to start off by saying that this project was actually funded by the Utah AHEC Mini Grant Program. And for all the students that are here, all the med students, if you're interested in like getting grant funding or small grant fund to like further any of your projects or initiatives, this is a really great way to do it. The applications to become an AHEC scholar closed February 28th, so this is something just to think about. It was a really amazing experience actually having money to run a project like this. So our project really wanted to focus on how can we go into underserved communities, how can we hear their stories and experiences and what they're going through and learn from them in a way that we can then bring back and use that insight to help better serve them. And so we use this qualitative research lens to connect with and learn from our underserved communities. And first, we wanted to characterize the experiences of underserved communities within the local healthcare system. And secondly, we wanted to actually assess how different underserved communities had different unique experiences and different unique needs. So what we did is we partnered with community health workers from 6 underserved communities in Utah. And I want to give a huge thank you to all the CHWs that worked with us on this project across all these different communities. The CHWs here with the red circles around them are actually community health workers that are engaged with current UVU med students right now. So it's just really amazing that we have the opportunity to work with these community health workers and learn from them and serve our communities with them. So we partnered with them and we kind of designed these focus group prompts. And what we did is we went to the community health workers and we asked which of these questions are most relevant to your communities. How can we design a focus group that is very relevant to your community so we can learn the most from your community members? These are some sample questions, but there were 6 main areas. We asked about health and wellness, healthcare ideals, individual needs, interactions with healthcare, navigating the healthcare system, and integrating culture into healthcare. And I want to say one of the most amazing things is that the CHWs we work with actually really helped us tailor each of the focus groups to their individual communities. And I think it's one of the reasons why we got such vulnerable, honest answers from the community members. And so that was a huge part in what we did. Then we conducted 1 to 2 CHW facilitated focus groups in each of these communities, transcribed, translated, and then conducted qualitative analysis and generated themes. So these are just some numbers for the number of focus groups we conducted, total number of participants in each of these communities. And 8 themes emerged from our qualitative analysis. The most prevalent theme was barriers to accessing care, which are factors that affect how difficult it is for community members to participate in the healthcare system. And this quote, "You can't have a healthy community when people can't even get to the doctor's office." The second theme that emerged was this theme of personal or systemic trauma and just the negative emotions that arise when interacting with the healthcare system. And what was really interesting is that this theme came up in both individual, like personal and historical context. One of the quotes, I will put something off until it's just really bad for the fact that I hate to be judged." I think this is a sentiment that a lot of underserved populations resonate with. The third major theme that emerged was this idea of humanistic healthcare, attitudes and behaviors demonstrating interest in and respect for patients' psychological, social, and spiritual concerns and values. And this quote, "Let's stop calling a healthcare patient a customer. We are not customers. We are not numbers. I'm not a statistic. I'm a human being. I'm a healthcare patient. And how can we empower all of our healthcare patients to feel this way?" The fourth thing that emerged was this idea of building relationships. So efforts within the medical system to build meaningful and lasting relationships with both individuals that come into the clinic and the communities that they serve. And this quote of their doctor, does a great job, always gives me information about new treatments that we decide to do. We do it as a team, so I have trust. I trust him. The next theme was centered around cultural competency, this ability of providers and organizations to effectively deliver healthcare services that meet patients' social, cultural, and linguistic needs. I really like this quote of how nice would it be if all of our customs, our way of being, were well understood. That would be ideal for each one of us because our health is at stake. And I really like, if you think about what that means, like how important it is for you to be seen when you go access healthcare. The next theme of dimensions of health refers to the diverse ways that people, communities, and cultures conceptualize health and well-being. Health refers to the physical, mental, and emotional well-being that keeps you balanced, that keeps you in a full state of personal certainty to be able to conduct yourself in the best possible way. The seventh theme, navigating the healthcare system. This just applies to how people approach entering, navigating, getting their needs met within the healthcare system. And this quote of, that is also where my fear comes in from seeking medical care. I think I'm going to mess up somewhere like that because I have so many times because there's so many fine prints. I still feel this way as a medical student, and I'm sure a lot of patients feel this way too. And something to keep in mind when interacting with them. And the last theme of advocacy, ensuring access to care, navigating system, mobilizing resources, addressing health inequities, influencing health policy, and creating systemic change. And then focus group participants would talk about, like, I do find sometimes that it's hard to advocate for myself. Again, it just comes down to that intimidation process. So how can we empower patients to advocate for themselves as well? So the 8 themes that emerged were really great, but I think the cool thing that came out of this project is the fact that each unique community theme prevalence varied among them. Different themes were more or less important to different communities. So, for example, in the African American community, this theme of personal or systemic trauma was really prevalent, and a lot of it had to do with historical context, historical trauma affecting the way things are today. So many things happened previously. They didn't start today, healthcare, and especially healthcare for my community. And they, the supposed helpers, were sabotaging us at one time. And not only me, but others as well, all the races as well. So there's this big question mark about what are you really doing with me? What are you really giving me to take? So there's a lot of questionable past activities that blend in today's decisions, if you will. And then this other quote. So my problem is when my doctor refers me to a specialist, I'm always the person who thinks, is he going to accept me as a Black person and do right by me? Are they going to feed me? Are they going to be back there doing something to my meal? You can never tell. And that's how I feel seeking medical attention. And I think that's just a very heavy feeling to sit with, that patients come into the clinic with these thoughts and these feelings. In the Native American community, this theme of dimensions of health was the most prevalent theme that came up. And this idea that health is so much more than just being physically healthy. So I believe that health would involve or include not only being physically healthy, but being mentally healthy and spiritually healthy. And then, another thing I think many of us do, our native ways, our prayers. Always pray for yourself, pray for your family, and pray for community, pray for home. It doesn't hurt to do that. There's a lot of ways we can support ourselves and each other and anybody that wants it. Pretty low charge. I think for this community especially, what can we do to help empower all these ways that they attend to their health and the health of them, their family, and their community? In the Pacific Islander community, this theme of humanistic healthcare was really prevalent. For me, like in the past when I've gone to the doctors, I do not know why it didn't feel like a safe space. The place you go to improve your health and empower your life doesn't feel like a safe space. That's a hard thing to sit with. Like my ideal visit would just be to know that I'm getting taken care of and that my concerns about my health are being listened to and stuff like that. I know especially with like therapist-wise, they don't really understand my experiences being a Pacific Islander and stuff like that. So it's really important to think, how can we see each of our patients as humans and validate what they are going through, even if maybe we don't have the same experiences as them. In the Hispanic Latino community, barriers to accessing care was the most prevalent theme. The system is very confusing, yes, really, and sometimes not in your language, so it makes it more complicated. And then because sometimes the translators or the children translate, or the translator sometimes, you also get the wrong diagnosis, but they do not know the terminology. Some of the older people who are translators are people who can learn something and do not handle simple terminology to explain to the doctor or to the patient. So how can we focus on addressing some of these barriers? And I saw a poster back there about translation services, which was awesome. And then the rural Utah community, the most prevalent theme was barriers to accessing care, and a lot of the community members talked about telehealth and how it's kind of changed the way that the rural community accesses care. But the quote that I thought was really beautiful was this building relationships quote. And remember Dr. Jesse, he used to do Saturday walks with Jesse or whatever, and I thought that was kind of cool. Yeah, just so he could get familiar with his patients or they feel comfortable around him. Like he would just go for a walk and whoever wanted to go could go. He's such a cool person. He's perfect for rural care. I feel like that's such a heartwarming example about physicians going and building community with the patients they serve and making sure that their community feels comfortable with them. And so those are the results from this project that we did. And then thinking forward for the student-led clinic initiative, I just thought I'd take a moment because I know we've been running these student-led clinics for a bit. If any of the medical directors of the student-led clinics wanted to share any insight, have any of these themes kind of come up in your clinic, and in what ways? What have you seen, experienced, noticed? If anyone feels like sharing, no pressure. Yeah.
I'm happy to speak up. So I'm one of the co-medical directors at Midvale Community Building Community Clinic. And I mean, all of these themes are common among the patients that we see there. The one that jumped out to me probably predominantly, or at least first come to mind, was about barriers to accessing care. And the referral system from Midvale is fairly complex because we're dependent on donated care and donated imaging, donated labs. And so there are like 4 or 5 different health systems that are interfacing with Midvale in order to get our patients access to subspecialties and imaging and labs. And that can be really difficult for our patients to navigate, and it requires a lot of work by the clinic to make it happen, and then also just a lot of work by the patient to then go do it, and then a whole bunch more work to get it all to the same place.
Yeah,
and to achieve good care. And so that becomes a major barrier for our patients.
absolutely. And that is what a lot of the community members talked about too, is like, I go to the doctor and then I'm told to go to these 3 more places. How do I find childcare for these 3 more things I have to go do now? And how do I keep up? Honestly, yeah. Thank you for sharing. Does anyone else want to share? Okay. All right, well, that's all I have, but for the discussion questions that we're going to be having later, there are a couple questions that I'll just throw out there now. If you have any thoughts or want to chat about it later, I would be more than happy to. The first question is, what are some barriers that prevent students and providers from reaching out to community health workers for support? Like, what stops students, especially, I think, from reaching out to community health workers and getting that insight in the moments that they need it? How can we facilitate students building longitudinal relationships with community health workers from various communities? Because sometimes it can feel like you reach out to a community health worker to solve an immediate problem, but how can we work on building that longitudinal relationship so that community health workers are more part of the system and students are right there building that relationship with the community health worker like they would with any other provider? What would a tool look like that allows students in clinic to engage with community health workers from the same communities as their patients? I think that also brings up the question of, is like a handful of community health workers that serve a diverse population. Is that enough? Like, or do we need more insight from more community health workers? And then question 4, how do we support providers and student-led clinics to be role models for cultural competency and humility? I think that's something we're all learning how to be better at together. And how can we just all support each other in that process? And then how can we integrate solutions for these themes into the patient care process, specifically like including it into the HPI of like, how have you worked with a community health worker before? Is that someone we can contact beforehand to get an idea, get more context for how your health fits into your life at this moment and stuff like that. So we'll definitely be discussing this later at table 7 if anyone is interested. Thank you for your time.
We have time for this one.
Absolutely. If anyone's.
So if there's any questions, we have time for 1 or 2 questions. Thank you so much, Karishma, for this.
Thank you.
Appreciate it.
Those of us in this online group are blocked from asking questions at this time, I suppose.